Well, to discuss the state of our public health facilities, I'm joined now by the Daily Maverick's Mark Hayward, who has spent much of his career focusing on health issues. Mark, thank you so much for joining us. Listening to those two reports, it's just utterly disheartening. It is not exactly a news flash that our public health system is under serious strain. We've known that for a long time. But what surprised me is the story from the Eastern Cape that 80% of people who go onto a ventilator with COVID-19 in a public hospital just don't recover. Shouldn't we be doing better by now? We've had a long time to prepare. We've known that oxygen is a problem, that ventilators are a problem, and we've got better therapeutics on COVID-19. We're seeing second waves in other countries, incredibly high infections, but the death rate is not higher than the first wave necessarily because they are better prepared. Why aren't we?
Yes, Sally, I mean, if I can just first say that it's distressing and shocking to listen to those reports. And it's even more distressing when, as you say, all of this is preventable. People are suffering and people are dying who do not need to suffer and die. I mean, I would draw a parallel here with the Life Esidimeni disaster. Those were preventable deaths. These are, again, preventable deaths which are taking place largely as a result of negligence, mismanagement, and corruption. Civil society has been drawing attention to the Eastern Cape in particular for a decade. 5 years ago, we published a report, I was at Section 27 then, called Death and Dying in the Eastern Cape. And everything I've just heard your reporters talk about, oxygen shortages, shortages of ambulances, shortages of personnel and critical staff, problems with infection control, all of that was evident in 2015. That report went right in front of the nose of then Minister Aaron Motsoaledi, who promised action. And yet 5 years later, it's clear that very little action has actually taken place. So it's terribly shocking. And I guess for me, it raises two questions. The first question we have to ask ourselves as citizens is, what are we going to do in 5 minutes' time? What is the government going to do to try to minimize the harm, bring in support from outside, make sure that there are the professionals, that there are the equipment, etc.? Because the Eastern Cape hasn't hit the bottom yet of its crisis. And the second issue after that is, who are we going to hold accountable for this disaster?
Well, I mean, that is an important question because we saw last week our health minister fly down to the Eastern Cape pushing for the rapid testing so that we know which areas are most problematic so they can try and help. But it always seems to be done in a rush when we could have predicted that this was going to happen. And what disheartened me is that the government says reckless behaviour has led to hospital beds being fully occupied. Yes, reckless behaviour does lead to higher COVID infections, without a doubt. But we've had time. Why is the Eastern Cape in particular such a problem? Because the Western Cape seems to be better prepared. Here in Gauteng, we've got Nasrec, a bed sitting around waiting.
Well, I can answer that. It's because of the reckless behaviour of government officials over a very long period of time. The reason that the Western Cape has managed the crisis so far and the Eastern Cape is failing dismally is because the Western Cape is a well-managed provincial health department. Gauteng has some very serious problems, but it still has major tertiary hospitals. It still has still the center of much of the country's clinical expertise at a tertiary level, at an infectious disease level, etc. Eastern Cape has a broken health system, a corrupted and broken health department, where many health professionals have fled because it's impossible to practice medicine down there. And the people who remain, who you interviewed, are heroes and heroines doing their very best under circumstances where they get next to no help from government. We talk about COVID-19, people with comorbidities having greater vulnerabilities for COVID-19, but But here you're looking at a health system with comorbidities, and those comorbidities are corruption, staff shortages, budget cuts, equipment shortages, and a failure of management. I'm sorry to say this, but yeah.
Sorry, Mark. And I have to jump in on the budget cuts, because this is the thing that astonished me as well. Treasury's frozen many medical posts, and this is nationally. And this is in the middle of a pandemic. And I'm just wondering how a decision like that is made when our government seems to have enough money to rescue SAA again, and also to put retrenchments at the public broadcaster on hold to think about whether they really need to retrench what is, by all accounts, a bloated management system at the national broadcaster. What does that say about our priorities as a country?
Well, it says that our government, first of all, doesn't understand its constitutional obligations, its legally binding constitutional obligations to health and to dignity of people, Section 27 of the Constitution. Secondly, it suggests that the people in the Treasury don't give a damn, pardon me using that language, about poor people who depend on our public healthcare service. You know, we are implementing austerity measures in health, in basic education, at a time when the system is on the floor and when all sensible economic advisors in the world are saying this is not the time for austerity. Yes, if you need to make savings, then clean up corruption, clean up wasteful expenditure, as you've said, clean up the billions and billions of rands in irregular expenditure, stop MPs from flying business class around the country, stop President Ramaphosa from spending 150 million rand a year on his private protection and his blue light brigades. Those are the things that can go, not people's essential health needs. And so we need a plan. We need a plan for tomorrow morning, but we also, Sally, need a plan that takes us over the next 5 or 10 years. As we sit here at this moment, our country has only just finalized a national human resource plan for health, i.e. how are we going to get our doctors and nurses and pharmacists and community healthcare workers, but it still does not know how it is going to fund that plan. So if you dig into what is going on in the public healthcare system, what you find, I'm afraid, is a horror show. And it needs to be brought to light by people like yourselves as journalists, but more than just bringing it to light so that we can all express shock and horror, it needs solutions.
Absolutely does. And thank you so much for speaking to us this evening, the Daily Mavericks, Mark Hayward.